one of the biggest imbalances that most of us have is with our pelvis. So if you're looking at the pelvis from the side, you got your lower abs, you got your hip flexors, you got your lower back, and you got your glutes. Most of us, our hip flexors and our lower backs are much stronger and tighter, so it takes your pelvis and tilts it forward. Okay. Now, why a lot of us are like that? For many of us, it's inactivity, but also many of us when we sit at a desk, sit in a car, that causes that. But even most of it, even people like that work out, the typical workout actually strengthens those and actually adds to that. So, in really making it simple, if you recognize that that's you, you know, you really got to work your glutes, you really got to work your lower abs more than those other muscles. Also, another big reason why a lot of us are that, if you got a belly sitting on your hips, again, that tilts that forward. Thinking about this, some of you guys do yoga, Pilates, stuff like that. It might be the only reason, I'm sure there's probably other reasons, but in yoga and Pilates, you're always hearing, engage your glutes, pull your belly in. Okay, that's a big part of that. Now, thinking about this, if I'm not mindful of it and I just do it, or an instructor just says do a bridge of my lower back and my glutes, what do you think I do my bridge with? Yeah. Okay. So unless I'm really mindful of that, and unless I'm really mindful of engaging my glutes, I naturally use my back, and most people are going to use their back. So to really tuck your tailbone and pull your abs in as you do that. Same thing for a push-up, even a push-up position or a plank, whatever you look at it. Okay, unless you're really mindful of what am I using to stabilize from the board.
From the board, I'm going to go with your hip flexors and your lower back.
Yeah, I'm gonna use mostly my hip flexors and my lower back to stabilize, unless I pull my belly in, engage my glutes. So even not just working those, but in all your stuff, thinking, okay, am I really using my glutes? Am I really using my lower abs? And along with that, that definitely affects our lower back, whether it hurts or not. Like I said, for 20-something years, I knew this was really tight and it had minor pain, but I just ignored it. But at this point, I can't ignore it anymore. But I also told you the other day, when I pulled my hips back, I realized, wow, there was a lot of pressure on my knees that I never was aware of. I just didn't even think about it. But it affects your knees, your ankles, your shoulders, it affects everything.